Hello friends, welcome back once again. My name is Bibu and I'm the Director of Certification, Universal Fitness Training Academy. And as usual, I have come up with another important episode. And today's episode is really interesting. And again, that is again based on evidence-based science. And I had been planning for a long time to, make a video on this. So let's start. Rigorous cycling can cause urogenital disorders. So I have got a lot of friends and I have got a lot of relatives who are into cycling nowadays. And it's been, I have seen that post-COVID, there are a lot of people who are, enthusiastic and, they have been, doing regular cycling, long distance cycling. I have some of my known friends also. So it's just a piece of advice to everyone, being a sports and exercise scientist and a strength and conditioning coach. That it's my duty to, make you aware about, which is related to exercise and, which might cause some harm if done excessively. So rigorous cycling can cause urogenital disorders based on evidence-based science. So let's start. So as you can see that history of bicycling, a small history, introduction of bicycling. Bicycle riding is one of the most popular means of transportation, and that's true. Recreation, fitness and sports among millions of people of all ages who ride on road and off-road using a variety of bicycle types. It is also readily available from aerobic, non-impact based exercises with established cardiovascular benefits. So bicycling is really a very good exercise, but as you can, there's a saying that, anything in excess will always definitely cause a lot of harm to your body, whether it's bodybuilding, whether it's weight training or resistance. But it's my duty to let you know about all those harmful side effects. When to know when to stop. You should know your limits. So, but its increasing popularity has also resulted in a growing number of injuries and a subsequent need to better understand the workloads on the body during this complex movement and sports activity. So, in order to discover the best ways to exercise, scientists embarked on studying cycling with various methods. So basically, the research on bicycling and the laboratory studies on cycling were basically launched in the 20th century, early 20th century, when the first cycling ergometer was built basically by Krog and Linhart in 1913. So basically, it's not that old, and basically, bicycling has always been a preferred choice for strength and conditioning coaches, physiotherapists, sports medicine specialists for rehabilitation purposes. The main reason is that it can train a person without putting any kind of stress on their joints at the early stages. I am talking about exercise cycling. So here you can see that a long distance bicycle riding causes prostate specific antigen to increase in men aged 50 years and over. So you can see that the title of today's topic, as you can see, that urogenital means whatever is related to the urinary system, the urinary bladder and our pelvic region and our genitalia. So it's based on that. Basically, if you do too much of excessive cycling, it might, alter the, muscles and joints and the organs near our pelvic region. So there's a study which has been done by Sandra L. Majak, Julian A. Baylis, Shane D. Hanks in the Department of Sports Medicine, Western Institute of Sport, Melbourne, Victoria, Australia. So they have done a study on 129 male participants ranging in age from 50 to 71 years, means approximately 55 years, in a recreational group bicycle ride between 55 and 160 kilometers. Then after that, the blood samples of total PSA were analyzed within 60 minutes before starting and within 5 minutes after completing the ride. So the results were then, what are the results being found in this study? So bicycle riding causes total prostate specific antigen to increase by an average of 9.5%, and the number of participants with elevated total PSA using standard PSA normal range cutoff was 4.0 nanogram per milliliter. So normal level is 4.0, but almost by 9.5, almost 10% increase in the PSA level has been observed during that study. So conclusion is that cycling causes an average of 9.5% increase in total prostate specific antigen in healthy males, cyclists more or less than 50 years old when measured within 5 minutes post cycling. So it has been considered that the increase clinically significant as the number of participants with an elevated PSA according to the established cutoffs increased post-rite based on research published to date. The author suggested 24 to 48 hours of abstinence of cycling or any kind of sexual activity before PSA test. So it has been totally proven that in this study it has been shown that excessive rigorous cycling can increase your prostate specific antigen, which is also a major biomarker or a major reason for having prostate cancer. Now, let me tell you what is prostate specific antigen, and how prostate function in our body. And it can happen to males and females too. Review article, and this is another review article which depicts about the other side effects of rigorous cycling. So this is the title. The title of the review article was "The Vicious Cycling, Bicycling Related Urogenital Disorders." And this study has been done by, review has been done by Ilan Lebovich and Joran Moore. And the study was done in 2004, October 26, and the Department of Urology, Mir Medical Center, affiliated to Sackler School of Medicine, Tel Aviv University, Tekronisvoski, Saint Kefar Sava, Israel. I don't know how to pronounce this name, but anyway, the Department of Urology, Claim Seva Medical Center, affiliated to Sackler School of Medicine, Tel Aviv. So they have confirmed that excessive rigorous cycling can cause urogenital disorder. Now let us see what are the urogenital disorders which can be caused by rigorous cycling. Next slide. So during the study, the methods which they have used is like, they have searched the whole Medline database in search of literature on bicycling and genitourinary disorders, was performed during multiple subjects, headings and additional. So out of that, 62% of the database from which they have collected this information, and it has been observed that research has yielded over that, it has been observed that disorders such as pudendal nerve entrapment, erectile dysfunction and infertility even has been observed. At the same time, the effect of bicycle has also increased in the serum PSA level. So, which has been already I have mentioned earlier. So, results. The most common bicycling associated urogenital problems are nerve entrapment syndromes, presenting as genitalia numbness. Nerve entrapment syndrome means, there is a nerve which become come into tissues. Then what happens, that you feel numbness on your genital area, and it can happen to men and women too, which is reported in 50 to 91% of the cyclists. So out of 100, almost 50 to 91% of the cyclists will either they will suffer now, or in the later part of their life they will suffer from numbness in their urogenital area. So and other less common issues are 13 to 24%, and which are basically priapism, which is basically it's a extended erection period, penile thrombosis, or clotting of the penile area, infertility, hematuria means bleeding, torsion of the spermatic cord means through the cord through which the sperm is being ejaculated, that sperm might get it might get damaged, prostatitis, inflammation of the prostate, perineal nodular induration and elevated serum PSA level, which are basically reported infrequently, but the percent is not less, 13 to 24. Okay, so here is the anatomy of the abdominal region. This is the prostate gland. The red part is basically the prostate gland, and let me tell you what is the function of the prostate. This is the female pelvis area, this is the male pelvis area, there are some of the pelvic floor muscles which is in our body. So the function of the prostate gland, why prostate gland is so important? The function of the prostate gland, let me tell you, when you will be 40 plus, you need to often check your prostate every 6 months. I do that, and males, you really need to, check your prostate level every 6 months, so that, there is always a chance of getting, prostatitis or, prostate cancer or something like that. So in case of females, the prostate is a very important gland in our body. The prostate gland is situated in the true pelvis and plays a supportive role in the male reproductive system. Its principal purpose is to secrete alkaline solutions, means, which creates a buffering agent in the body to protect the sperm in the acidic environment of the vagina. So if somebody is having a physical relationship, the alkaline solution which is secreted from the prostate gland helps in, controlling the acidic environment of the vagina. So the fluid acts to balance the acidity of the vagina, which increases overall lifespan of the sperm and the greatest length of time to fertilize and act successfully. So the fluid contains supportive proteins and enzymes that provide nourishment to sperm. The added volume of the prostatic fluid also, seminal fluid and sperm, allow for easier mechanical propulsion of the urethra. Means the prostate gland also acts as a sphincter muscle which helps in improved ejaculation of the sperms. So it's a very important organ. And another reason which causes due to rigorous cycling is the pudendal nerve entrapment or the pudendal neuralgia. So this here you can see the pelvic structure. This is the male genitalia, and you can see that from the vertebral column S2, S3 and S4 the nerves are coming up, and these nerves at the middle of this pelvic area, this is called the pudendal nerve. The pudendal nerve extends from the S2 sacroiliac joint, S2, S3 and S4, and it surfaces through the penile area, through the testicle area. So what happens is that if too much of rigorous cycling is done, or there is too much of trauma, or if you are sitting for long hours, or if you are doing too much of hip flexion, just like in sports or in cycling, and it also happens because of radiation therapy. Those people who are suffering from prostate cancer, if they do radiation, or rectal or gynecological cancers, can also cause pudendal nerve entrapment. So if this nerve is being paralyzed because of too much of rigorous cycling activity, the other organs which is connected to those, including the testicles, including your male or female genitalia, they will get numb. So that's because of that you will have neuralgia. And pudendal nerve is a mix of sensory, motor and autonomic function. So if the pudendal nerve is damaged, a person can, or inflamed due to injury or too much of rigorous cycling activity, the nerve can also result in bladder, bowel, sexual and autonomic dysfunction. So you might lose your bladder control, or you might lose your sexual control also. You might also suffer from sexual dysfunctions. So priapism is basically, which is like an extended, erection of the penis for longer hours, and it is very, again it can cause, necrosis in the penis, and it can also cause damage of the penile tissue. Penile thrombosis also might occur, which is also called the Mondo's disease. Thrombosis means basically what? It's like clotting of the blood, and thrombosis also can be caused by cancer, neoplasms or extra growth, excessive sexual activity or abstinence, or other issues include fertility. It might because of bleeding, hematuria, or a torsion of the spermatic cord, and these are basically the side effect of rigorous cycling. So now I already have told you about the problems, but now what is the solution? See, being a strength and conditioning coach, sports and exercise scientist, my job is to give you solutions. These are the things which can occur, but there are solutions too. We need to understand the biomechanics, basic biomechanics of the cycling. There are 3 points of context. There are 3 points of context in cycling, meaning 3 points of the body: pelvis on the saddle, hand on the handlebars, foot on the pedal. Something to be aware of that is that these areas can undergo a lot of stress. Your pelvis, your the foot, and especially your neck area. They might got sustain. All these three. It can cause a lot of wear and tear. Okay, you might have cervical spondylitis too. So this is basically it's a graph which shows like the drag force. It's the gravity which is acting on while a cyclist is doing cycling. This is how the forces of gravity acts on. This is the drag force, which like kind of this kind. Even in water also it causes drag force. This is the power supply. This is like the gravity is working, and the center of gravity is working downwards like this. So this is basic biomechanics of cycling. You can see that at the top position, when the knee is flexed, or the hip during the hip flexion movement, the power position is basically when you are pushing downwards, that is the power position. And when you are flexing your hips, basically your psoas muscle, your rectus, femoral muscles comes into play. And when you are pushing during this power position, your hip extensor, your glutes, your quadriceps, okay, your calf muscles, your soleus at the bottom position, again your calf and soleus, and during the recovery position, all these joints come into play. As you can see that this is basically the phases of cycling, muscles involved during cycling. So this is basically a movement clock. As you can see that at the 12 o'clock position, the hip extensors work in this manner. As you can see that when you are doing cycling in a clockwise manner, all these muscles, the quadriceps muscles, the hamstring muscles, they come into play when you are in the power position, and when you are in the top position, the hip flexors and the psoas and the groin muscles come into play. This is just a graph, just to make you understand. So these are phases of cycling. There are basically two main phases of cycling. Power phase from 12 o'clock till 6. This 12 o'clock till 6 is the power phase, which is the half of cycling. And then the recovery phase from 6 back to 12, from 6 to here is the recovery phase. And 12 o'clock, this is also known as the top dead center. It's the top dead center when you are applying no force. And 6 o'clock is known as the bottom dead center. Okay, the bottom position. The power position is also called the bottom dead center. This and the role of bike feet. So you need to understand, for safe riding, you need to know the bike feet. This is basically a standard protocol. Recovery phase of the cycle is pedal stroke, trunk, back and arm, joints of the lower limb, and the roll in cycling. Basically, there are 4 pillars of cycle feet. Foot position should be proper. Saddle height should be proper, stern and handlebar position. So foot position should be in such a position that when you are extending your hip, there should be at least 15 to 20 degree of knee angle at the bottom position. The saddle height would be, at the hip, at your hip position, and the bars and the handle position should be in such a manner that you are maintaining a 45-degree angle on your body. Otherwise, you will hurt your back. So these are the basic positions you can, cover up. And these are basically bike fitting according to different models of bicycles, urban bicycle, mountain bicycles, touring, sport, performance, 2.5 centimeter above to 2.5 below the level of the top of the saddle. The saddle should be 5 centimeter to 10 centimeter below the top of the saddle. In case of mountain bikes, for sports and performance bike, 5 centimeter to 10 centimeter below the top of the saddle. So these are basically, standard guidelines. Keep going through the video, you'll be able to understand. Then, now, the main thing. Strength and conditioning exercises for performance enhancement, injury prevention. In order to, do safe riding and in order to, prevent any kind of injuries, you need to do some strength and conditioning and sport specific exercises, specially formulated for cycling. One is you can do hip flexion exercises like this. You can do squats. You might have seen in cyclists that they have got big thighs. And at the same time, you also need to train your glutes, your core muscles, your postural muscles, so that you don't hurt your back. And at the same time, you should also do some mobility exercises for your groin area, for your psoas muscles, for, all those muscles, you need to train them. So that's it, guys. And before I wrap up, I would like to show you the, this is basically the pelvic area. This is the pelvic diaphragm, which I'm talking about. So these muscles basically undergo a lot of stress. You can see that how these muscles are being contracted. So this is basically the pelvic floor area. Okay, you need to strengthen these muscles so that you don't have any kind of issue. If you suffer from, any kind of numbness or in this area, then all these pelvic floor muscles will get weak. So that's why you really need to strengthen your core muscles, and you really need to strengthen your core muscles and your glute muscles, your hip extensors and the groin muscles, so that you don't suffer from any kind of injury. So for more video like this, and if you want any kind of information, or if you want to design a specific workout program for enhancement of your for your bicycling career, for amateurs, for professionals, I'm ready to help you out, and I will give you the link in description below. I'll give you my number. So till then, guys, stay safe, be strong, and happy cycling. Bye bye.